And I am Tina Cosby, and we are here now with Dr. Heather Fretwell. Dr. Fretwell is a board certified psychiatrist with the Saundra Eskenazi Mental Health Center. Dr. Fretwell, welcome. Glad to be with you today.
Thank you so much for having me.
Thank you. I love the topic. Celebrate your health, ladies, and take care of yourself. That is something that you hear often, but I don't know how many of us ladies, women, actually take it to heart. Why this special emphasis on us as women to not only celebrate our health, but to take care of ourselves?
I think honestly is that it's the naturalistic role, and still, although there's more balance, I would say in recent years than perhaps prior in our society, but
Mhm.
still we are the caretakers of others, and many of us fundamentally find our identities in that. And while there's certainly nothing wrong with that, I mean, we tend to get a lot of internal rewards and external rewards
Mhm.
for being self-sacrificing or for extending ourselves or stretching ourselves or focusing on others. But we run our risk of being depleted if we don't turn
Mhm.
that same consideration on ourselves. And so I think it's just very helpful to be reminded that as a person, as an individual, as a woman in our society, we merit that same kind of consideration and self care too.
So you call this a naturalistic role. Are you are you saying that it's something that is inherent within us as opposed to something that we're taught through society?
I both believe in nature and nurture. If you look at the naturalistic parental bond for both men and women, it's definitely there. Um,
Hmm.
if you look at the roles of us in society, I think we get taught a lot, as you
Mm.
emphasize, that our job is to be the primary caretaker and primary home organizer. There's been a lot written in recent years about the mental work of kind of organizing the household and how that tends to fall to women, including when, say, woman and their um, partner, perhaps a husband, perhaps another kind of partner. But if there's uh, tends to default to the woman to have like the organization of, hey, the kids need this, and then perhaps somebody else in the household will help with this. Go pick somebody up or take somebody to a practice, or go purchase something that's needed for a project. But there's that organizational effort that tends to
Mhm.
default, and that we tend to, I think, be trained to that. We tend to model that from prior generations, and I think we still have a lot of messages in our society and from media that that's what we should be doing a
Yeah.
lot of.
And I think that's important background for what we're about to talk about. But when you said you believe both in nature and nurture, and it just kind of reminded me, Freud, Jung, so many different things. But as we're talking about taking care of ourselves and improving on our mental health, you are a board certified psychiatrist. You are an MD, and yet we've talked to a number of psychologists as well
Mhm.
in this very field. So very quickly, as we move through our discussion here, the difference between a psychiatrist and a psychologist.
Oh, thank you. It's an important difference, but a lot of folks, uh, uh, we kind of end up getting fuzzy because we both are key workers in the field of mental health. Psychologists, of whom I'm really proud to claim several of them as my mentors, and have great relationships with, um, in terms of their education, really focus on the brain and on um, mental health, on therapy, and quite frankly, on math. There are psychologists out there that can do the kind of statistics that most of us would run away screaming from.
Wow.
they, they are really talented folks. A lot of the major kinds of studies in mental health have a psychologist
Hmm.
in their heart, looking at different measures, developing different measures, testing different measures, looking at how do we even talk about what's the outcome of a study. Um, and they are really experts in the mind. They are really experts in psychotherapy. They're experts in various mental health conditions and the psychotherapies that are evidence based for that. And they're really experts in developing that evidence basis. To become a PhD, they have to participate and publish their own research. And so I think it's a very prestigious field. and one that is very respected. It is how different from psychiatry. As a psychiatrist, I went to medical school just like your primary care doctor did, just like your surgeon did. I did all those rotations in medical school. I had the privilege of delivering babies, standing in the surgery field, rotating through all the different hospital services. My training was in the IU School of Medicine, so I rotated at Riley, at the VA, at the Old Wishard, and through a variety of outpatient offices in the local area. And we are trained much more broadly on the whole body. And then specifically in a 4-year residency, we are trained specifically on the brain biochemistry, medications, and how those medications interact with the whole body and other medical conditions. And so we kind of teach each other that we graduate from the 24th grade after after 4 years of college and 4 years of medical school and 4 years of residency. And so our focus is much more medical in nature and includes a variety of those disciplines. So, for example, I might not treat seizures, but it's important for me to be familiar with the medications that treat seizures and how anything I might prescribe might interact with somebody's seizure condition or with the medications that they take, and go on for hypertension or diabetes or other kinds of conditions.
So what types of therapy, if you will, or treat, do psychiatrists do talk therapy like psychologists do? Or I mean, how does that work?
So we're trained in it, and different ones of us focus differently in it. We're all trained at a minimal in what's called psychodynamic psychotherapy, which is kind of a broad general term for a lot of ways of a therapy that's the goal is to, as Freud would say, make the unconscious conscious so that you can fiddle with it and then stick it back under the hood and hope it works better. And if it doesn't, you go try to make more of the unconscious conscious so that you can really be making decisions in your lives instead of reacting to themes that have been present.
Freud or Jung?
There's a little bit of both there, probably.
Okay, we'll get back to that one later, I guess. So,
and we're also trained in CBT, which is cognitive behavioral therapy, which is kind of another branch of psychotherapy. And then, depending on interest, we might go back onto further training. Myself, I'm a little bit of an odd duck because I'm extensively trained in a cognitive behavioral therapy called Schema therapy, which is designed for treatment-resistant depression and for borderline personality disorders and trauma-related disorders. And that's a major part of my practice. I'm a little unusual locally in that, but I'm not alone. There are several other psychiatrists in the area that also really specialize in administering psychotherapy as well as engaging in what we call like medication management services for folks who come to see us.
And very quickly, as simply as you can put it, a borderline personality disorder, because I hear that term in both disciplines.
Mm-hmm.
And
And so that's one of our diagnoses. It's an old diagnosis name that goes back to Freud. But really, it's folks that kind of grew up in chaos and often various kinds of traumas. Often the temperament is the most empathic and creative temperament that we have. But unfortunately, genetically, that can also be a temperament that's most vulnerable to trauma. And so folks grow up without being able to really hold on to internal stability. And so what results in is you have unstable relationships, an unstable sense of self, unstable and impulsive behavior, and when very stressed, sometimes an unstable kind of interpretation of reality, like people can get like transiently paranoid or feel like everybody's out to get them, or even like dissociated, like feel like completely numb or like they're actually to one side of themselves kind of watching what's happening.
Yeah. Mental health and mental wellness. They're especially in cultures like the African American culture, Black and Brown communities, mental health and mental wellness, there are stigmas attached to that. And especially with women being the as you said, having the naturalistic role as the caregivers and the just basically in charge or in control. How can we help women better understand that there is no stigma, or there should not be a stigma attached to seeking help for mental illness, or to seeking help for just any, to get yourself back on track, that there should not be a stigma associated with that. How do we get that through to us who basically feel like we are, I call it the social worker complex. That's my little thing, that we have to take care and solve everything. How do we get that through to us as women?
One of the things that I really encourage people to do is learn how to take their own advice. Because a lot
Okay.
of times, if we see somebody else struggling, we might say, maybe you should talk to your doctor about that, right? Or if we see somebody else struggling, we might not judge them, and we might say, "Oh gosh, they've got so much on their plate. I can understand why they're stressed. I'm concerned. I would really like for them to talk to somebody about that."
Mhm. Mhm.
But I think sometimes it's hard to turn that reflection on ourselves and to take our own advice. In fact, that's some really explicit advice I give to the residents that I teach, and they're adults at that point in time. But my best lesson to them, honestly, is to uh, get on in life is important. To one, to ask for help when you need it, and two, to accept that help because it's different things.
Mhm.
Um, and then second, I think in terms of the stigma, I think there's a lot of stigma is related to kind of like anger and fear, which I think is related to limited understanding of what mental strain is or what mental illness is, and fearing that we can't control it and that people will judge us and there must be something fundamentally wrong with me that I can't control my brain, you know. And so one thing that I really love to talk about too is um, how uh, it's interesting if we think about what is the most complex organ in our entire body. What would you tell me?
I don't. I mean, you're the doctor.
Yes,
You
I'm
tell
the
me.
doctor. I'll
Assume it's
tell you,
the
it's the
brain.
brain.
I would assume it's the brain.
Yes, the brain is the most complicated organ in our entire body.
Uh huh.
It's a few 100,000 cells put together with trillions of connections.
Yeah.
It's more powerful than our most powerful supercomputer still. Um, and what I think we tend to do is really fear when something goes wrong with it,
Hmm.
um, as opposed to understanding, well, this is a very complicated system. It's going to happen sometimes that, we're going to get too stressed or we're going to get too strained or, um, something in our genetics is going to not produce enough of a protein or too much of a protein,
Hmm.
and we're going to need some help with that. We're going to need some help with fine tuning this engine, this 3 pounds of matter inside
Hmm.
our skulls. That is the most complicated thing we know of. We haven't even quite figured out how to map it entirely yet.
So, how do you approach women of color, where the stigma is a real thing, that it has been taught, and in a lot of ways, a coping mechanism to get through the difficulties of not only being of color, black or brown, but being a female. These have been coping mechanisms that have been in place for decades. And the two that we talk about most often are suck it up. There's nothing really wrong, or the heavy reliance on faith that you're just not prayed up enough, that there's nothing wrong with you. And so there's a special area for us as women of color that I think it's a special hurdle that has to be cleared in terms of approaching mental health and approaching mental wellness. How do you approach that?
Very, very directly as I get to know them, because I think to be heard, especially uh, if I can say so, as a white woman
Hmm.
talking to people of color, is that I invite people to look at me and see how I work first. Because I think until I earn someone's trust, which I can't take for granted, that it might be difficult for me to say things that really contradict, as you say, all those many years of lived experience and advice.
Yeah.
Um, and so I start out by just trying to be very genuine with folks. And I'll start with messages such as, it's uh, maybe hard for you to believe right now, but this is not anything particularly that's your fault. is not something particularly that um, can be overcome by willpower, and that in
Mhm,
itself is no lacking in you. It's just like we can't mentally command our blood sugar to go from 250 to 150, we need some help with that sometimes.
mhm,
And so too, sometimes we need some help with regulating all these different kinds of things that our brain does for us or that our guts do for us. And we can learn some behaviors that assist that. But to first kind of try to say explicitly, um, I, there's a lot of background and history I know for you, and I can't um, demand that you trust what I'm saying right here at first. But this is really my approach, and this is what I think you're going to find over time.
mhm,
And I hope that you can learn to trust me, and we can go through this journey together as you
mhm,
realize, as we try to come to realize that um, mental health is part of life, it's part of wellness, and that having concerns for mental health is not a personal weakness, which I think that particular phrase is something that I try to say very distinctly to people
mhm.
because I think they come in thinking that it is.
Another part of that is this the shame factor that you should be
Mhm.
ashamed of yourself for going to a shrink. Why are you doing that? Why well, you should be ashamed of yourself. How do you address that the shame factor? Because I think that spreads across all boundaries. You know.
Absolutely. I also invite folks to bring in their family members. I also say to people, you know, unfortunately, there are these beliefs out there that just aren't true, and people get told that they should be pulling themselves up by their own bootstraps, which
Yes.
actually originated as a phrase that was, in the original sense, it was meant to illustrate how ridiculous something was.
Mm,
Um, and to try to tell folks, I know as you're coming here, as you're even talking to me, as you're considering taking a medication, it's like you're making decisions that fly in the face of what a lot of people are telling you, and that a lot of people even express a lot of concern that you might even be here today. But uh, I ask people, you know, to look at what they want, and how their path in life is going. And I sometimes will say, I think a lot of people really wish that were so. That a lot of people really wish that willpower was the only thing that really mattered.
yeah,
Um,
like it's all in your head. Yeah,
yeah,
just shake it off. It's all in your head.
and so again, I start talking a little bit about, you know, when we're bathed in stress hormones, things look differently. And by the time somebody gets to me, most of the time there's a lot of real genuine stress in their life that they can point to.
Hmm,
And I
hmm,
can start talking to them about things like um, cortisol response and adrenaline response and
hmm,
the impact of insomnia on their rest of health.
hmm,
Because by the time they come to me, a lot of times things are going enough badly wrong that there's a lot going on with their sleep wake cycle. They're not hungry, they're
hmm,
exhausted,
hmm.
they're scattered. Um, and the reason that they're here to begin with is that they're starting to feel desperate
Yeah.
because, you know, the beliefs that had maybe sustained them to that point are not enough anymore. And
Yeah.
so trying to acknowledge that and say, you know, I honestly think you're trying so hard that if it were possible, I think you would be able to make it through. The problem is that these messages just aren't reflective of the reality of our mortal human experience and how we're
Mhm.
built.
So, after all of these years of probably obviously not doing it right, how do we normalize the conversation around mental health to the point where people begin to accept it as a condition or a disease, something chronic like diabetes, from what we've been told, or asthma, or what have you, something that just needs attention, that is wrong with your body, as opposed to something that you've uh, done wrong. So we've not done well as a society for quite a while. So what do you think is important in getting that conversation normalized to where people begin to accept mental health and mental wellness as they do any other disease, because it is a disease, and people start to view it as a disease. When? At what point in time do we start to view it as a disease with all the others?
That's a great question. When I'm talking to patients and to communities, I do actually exactly those two conditions that you mentioned. I say it's like diabetes, it's like asthma. It's
Oh,
truly, I use
okay.
those.
Didn't
um,
know that. Never heard you.
but very excellent. You're tuned. Um, in fact, if you look at diabetes, you look at asthma, we've come to understand these as inflammatory diseases. In fact, that there's things that are going wrong actually even with the immune response,
Hmm.
and with
Hmm.
stress responses. And we find the same thing in depression and a number of anxiety conditions as well, is that we believe it is an inflammatory mediated response. But when you have inflammation in different kinds of places, it does different things. So in the lungs, it can provoke asthma. In the stomach, you can have irritable bowel syndromes. And in the brain area, you can have migraines, and you can have depression, and you can have anxiety, and you can have all the other kinds of things that go along with mental illness. Um, in fact, persons with some of these inflammatory conditions are more likely to have symptoms of depression or anxiety
Hmm.
because they are inflammatory conditions. And major ways that we think that medications for example, depression or anxiety work is actually by combating these inflammatory processes that are slowing down something called neurogenesis. Neurogenesis is the natural division and birth of new brain cells in your brain. And we didn't actually even know till about 10 years ago how important this was. But inflammatory conditions seem to slow that process down and also decrease how tightly and how complexly our neurons are woven together with this field of connections called synapses. And so what our medications actually do is on a physical level kind of amplify uh, some neurotransmitters that go in and boost signal to say, hey, brain cell, grow, develop, make new ones, and connections, hey, connections, grow
Hmm.
more robustly. Um, if you think about for example, a lilac bush, in winter is
Hmm.
like a state of depression for our brain. The leaves are gone, the twigs are fragile, some have broken off. And what we're trying to do is get to the normal state, which is a lilac bush in late spring, which is, if you've ever had a lilac bush that you've had to trim, right? There's branches going every which way, there's all kinds of leaves, there's all kinds of growth. That's actually the natural state of our brain. And what we're trying to do is restore that.
So, how do we let people know that it's real? That, I mean, again, how do we change the conversation, the energy around it, the knowledge around it? What's the best way to do that for us?
I think continuing that message of this is a real physical impact on your brain, just like diabetes is a real physical impact on your pancreas, just like asthma is a real physical impact on your lungs. And one of the nicest things I've heard in terms of this as a comparison is that asthma and having problems with asthma doesn't mean that there's necessarily problems in the environment. So a lot of people might say, for example, how
Okay,
can you be so depressed? You've got so much going on for you. Well, in asthma, you have all the oxygen that you need in the air around you, but you can't take it in.
gotcha. Yeah,
and
that makes sense.
And so really making that metaphor in depression, you may have actually even everything that you need right around you, but you can't take it in because, and the physical pathways in your brain are not growing like they should, and they're not robust like they should be. And if you're, there's a T-shirt going around that I really particularly love. It says, "If your brain's not making enough of the chemicals, store bought is fine."
Okay, I love that. I love. Well, you know what, Dr. Fretwell, you've established that we as women, and again, I love that phrase, naturalistic role. I, as we as women get smarter, more accepting of the information that's out there, more accepting of the knowledge, we as women probably are going to be among the first to seek out the help, I would assume. Is that correct?
That's what
So
we see, as women as in communities in our studies, we see women being more likely to seek help, than men are, actually, especially in Black and brown communities.
So how do we as women get that help? And that gets to probably the larger issue of access to healthcare, especially in Black and Brown communities or communities that may not necessarily always have had open access. And maybe communities that never considered access to mental health and mental health care. How do we start to educate ourselves, especially as women, since we're probably going to be the first ones out of the gates to get this? How do we educate ourselves about access to healthcare, especially mental health care?
So honestly, the first place is your primary care doctor. A primary care doctor will actually treat more uncomplicated depression than I will ever see.
A primary care doctor, what?
Will treat more uncomplicated depression than I will ever see.
Really?
Yes. Primary care doctors are actually quite knowledgeable about first line agents for depression and anxiety.
Yeah. So what if you don't have a primary care doctor?
Okay, those are fortunately pretty available. And then I'll also talk about more specialized care. But it's always a great place to start. If you don't have a primary care doctor in your area, um, uh, if you're in Marion County, there's multiple hospital networks that would be happy to see you and even walk you through like insurance applications and those sorts of things because that can be a real barrier too. Eskenazi, the Community Network, the Franciscan Network, the St. Vincent's Network. Um, there's also some really great local clinics, the Raphael Clinic on the north side, the People's Clinic on the southeast side. There's a lot of great local clinics, and so Google or there's a website called Aunt Bertha that has all kinds of community
Aunt
results.
Bertha?
That's what they call it.
Oh, I had an Aunt Bertha.
Well, how about that? Well,
How
she
about that? I tell you, the coincidences in this interview are amazing. So Aunt Bertha, is it auntbertha.com?
I believe so. If you do Google search for Aunt Bertha, Indiana, you will find it. Uh, in, it's an intervention put out by the Indiana uh, Department of Mental Health and Addictions. And Aunt Bertha is very smart. She has like you put in your zip code, and she has all kinds of resources that she can put at your fingertips.
Really? Yeah. So you had mentioned that you wanted to get into the specialized care that is available. Let's talk about that a little more.
So the other thing, and Google is your friend here as well, is community mental health center.
Okay.
You put in community mental health center in your zip code. There is one in every zip code for every zip code in Indiana, and that can help you. There's also a national treatment referral helpline. Let me give you that number. It's 1-800-662-HELP, and that can get you connected with both primary care and specialty mental health care.
Mhm.
And there are some differences in terms of how the different mental health care centers approach things like first appointments and wait times and other kinds of things that are kind of present in any
Mhm.
effort in which there are limited resources. But we do get people in, and at Sandra Eskenazi, we really want to get people in at least for that first appointment as fast as possible, and we really even try to offer
Mm.
walk-ins.
Now,
So
Sandra Eskenazi is not a residential healthcare facility, correct?
So Sandra Eskenazi is kind of a broad name for a organization that's got about 350 employees. We work hand in hand with Eskenazi Health. We have several outpatient clinics, and we do have 2 residential treatment centers
Oh, okay.
as part
Okay.
of our organization. Um, we also have run the inpatient unit at Eskenazi Health, and also at Eskenazi Health, there's 24/7 crisis services as well. So it's a pretty large organization. We're actually proud to be the largest and oldest community mental health center in Indiana. We celebrated our 52nd anniversary, I think, this year.
Oh, congratulations on the anniversary, 52nd. So, and again, we want to keep our focus primarily on women here, and I think that that's a good place to put it based on what you've already established. So, what are some of the strategies and best practices, best support practices that we as women can engage in on our road to better health, better mental health for not only ourselves but for those around us that we care for. What are some strategies and best practices that we can do? Because we tend to be kind of communal anyway.
Indeed, indeed. And so it's uh, as best as we can. I often would, there's a saying that was brought to me that I really like, is that most of the things in our life are choices between love and fear, and our lives are created by our choices between them.
Wow.
Um,
Wow. Wow. Okay.
so that's a big one.
Let me digest that one. Choices. Okay, go ahead.
And so in being loving to others and into ourselves, it makes a big difference. Now, um, love without boundaries can just put us in a depleted position. And so I don't mean that we don't have to have boundaries. In fact, boundaries can be also a very important thing to communicate clearly in terms of um, uh, somebody asks you to do yet another thing and you say, you know what, I'm tapped out for today. Maybe ask me next week. you know,
Mhm, mhm.
or if
And
there's
that's a healthy boundary. There's a difference between healthy boundaries and not healthy boundaries, correct?
that's correct.
Okay, that's a healthy one because it keeps you from being tapped out. I like that. Yeah, healthy boundary.
And also sometimes with others in terms of what you can tolerate from them in a given moment. So if you're supporting somebody with a mental health condition, they may be very irritable because the brakes on their brain are not working right in that
Mhm.
moment. Um, and that doesn't mean that you have to listen to them yell at you to support them. And sometimes you can say, "Look, I love you. I think we're getting to a bad place here. Um, uh, if you want to let me help you calm me down, we can do that. If not, we can try again tomorrow. If you're in a really bad spot, we can try accessing some emergency help. If you're so irritable that you're or so despairing that you're thinking about hurting yourself or somebody else, you really have to set limits again, those healthy boundaries in terms of um, uh, helping protect somebody and yourself in those situations. I do want to explicitly mention too that for these kinds of emergent situations, that 911 is always a great place to call. We're also soon in our state to be part of the 988 network, which is specifically for mental health crises. And so that's coming next year.
Specifically for mental health, nothing else.
That's correct.
988. Is that in the state of Indiana or is that nationwide?
That's nationwide, and we're part of it. Yeah.
So our federal tax dollars are going to pay for that, right?
And I think our cell phone bill is going to go up. Is how they're going to pay for it in Indiana.
Yeah, they just tack it on, sell, yeah,
yeah.
all of those. But that is good though. That's a really good network to have because it takes it out of the hands of the police department, which most police departments around the country don't want to deal with that anyway. They feel unqualified, and it's true. They're not qualified to handle mental health crises, and some of those things can go horribly wrong, as we've also seen in the news as well.
Absolutely. We can be proud in Indiana, well, in the Indianapolis area, that there's been initiatives for mobile crisis units now for several years, and those have been very successful.
Mhm.
And so we're continuing to look at how to expand those kinds of responses to mental health crises calls.
Yeah, I can see that line being absolutely essential and a wonderful resource, especially if, as you were talking about, because my mind was going in this direction. You're talking about in setting limits if someone is having an episode or what have you, and you give them a choice to
Mhm.
make. Sometimes doesn't that choice create even more stress on that person who may be stressing more, and you could just grab the phone, right? Or does giving them a choice, does that calm them down? Does that put them into a deeper set of a deeper set of circumstances where stress may be the ruler of the moment? I don't know, but either way that it might go, that helpline could be crucial.
Absolutely. And um, I think the default, if most of the time, should be to offer somebody a choice because I
It
think
is
that's
okay.
important.
So choices don't stress, just don't stress them out.
Oh, choices can stress anybody out, but at the same time, Sometimes in terms of being healthy, you have to inhibit something. The caveat would be sometimes in mental illness, especially in conditions like schizophrenia or bipolar with manic conditions, and also sometimes with substance use disorders, with things like methamphetamine intoxication or even synthetic marijuana intoxication. Somebody can be so irrational, you're trying to talk to them and you're not even getting any kind of coherent, rational
Mhm.
conversation. Those are times when you can use your judgment in terms of whether to give them a choice or whether to just call for help,
Mhm.
you know?
Yeah, yeah, and I think you could use your instinct in terms of,
Mhm.
when it's time to call for help, so,
Exactly.
uh, yeah, so that is really good, and I love hearing about that because we hadn't heard about that, the 988 network, and you said it'll be up and functional when, in 2022?
I do believe that's the goal. I want to say in spring, but we might actually have to look at the Indiana website to look at the opening date for that.
Dr. Fretwell, if you had a wish list in terms of improving, the environment around our acceptance of mental health, especially, for women, but for all of us. If you had a wish list, what would you wish could be wished into existence right now?
But nobody believes they have to be superhuman to be loved and accepted.
Nobody has to believe they have to be superhuman to be loved or accepted.
Yeah, that's a big one because don't we all kind of treat ourselves that way a lot? Like we expect ourselves out of ourselves than we might anybody else. We can be more
Kind of.
demanding on ourselves than on anybody else,
Uh huh. Uh
right?
huh.
So that's a big one. I wish we could all um, come to the understanding that we are having a human experience, and whatever your spiritual beliefs, as I've heard it put very beautifully put, that we're a soul having a human experience, right?
Oh wow.
So we're all having a human experience, and the human experience is messy. Um,
And you know what? The one thing we haven't talked about, which is an elephant in every room in which we go, in today's day and time, is COVID-19. And
mm,
we talk about it a lot, and people say, "Well, everything is not COVID. Everything is not COVID related or COVID based." But we can't complete a conversation without acknowledging the existence of this artificial existence that we've all navigated for the last year and a half.
Absolutely. It's the biggest impact that COVID has is on our connectivity. It made us justifiably for a period of time, and that includes sometimes now, afraid of connecting with each other in the way that we're meant to. Part of our human existence is that we tend to settle into essentially um, groups of somewhere between 25 and 75. If you kind of think about jobs and church communities and different niches and different social groups and families, that's what we're kind of geared to do is in these large social networks. And COVID, in some way, has devastated these networks in several ways. Sometimes by the deaths of important members of these
Mhm.
networks, sometimes by um, shutting down face-to-face communication, which is so important for our health and well-being, um, and in other ways by reducing other things that we do that are important to us. Like I know a lot of churches had to go virtual, for example, and a lot of
Mhm.
sports couldn't happen. A lot of uh, naturalistic outlets and positive coping skills for a lot of people would be things like team sports, the local bowling league, and that goes all, the baseball team, the church softball team, all the way through adulthood. And so many of our normal coping skills, even with stress of life, were put in abeyance, at least for a long period of time, at the same time that we were getting more stress. And so this is, I think, a reason that in terms of mental health access, we've seen such an outpouring of need, specifically for folks with depression and anxiety conditions in these last 2 years.
So, what do you think COVID has changed permanently, if anything, and how do you see us emerging. Well, I think we're in somewhat in a lot of phases now. We're in some emergence now, but
Mhm.
how do you see us eventually coming out of this, and what do you think has changed for forever?
The way out, I think, very much is vaccination, and I speak that gently because I know there's a lot of folks that are very suspicious still of the vaccines and what that might mean. I can just tell you that in the hospitals, what we're seeing are folks that aren't vaccinated. The rare handful of folks of people with vaccines that we see that need hospital level care are folks that also have medical conditions that affect their immunity. And so the vaccines we're finding just on the societal level to be so helpful in decreasing the epidemic quality of these infections that are that range again from the worst flu you ever had to nothing to life changing or life ending symptoms. And so truly the vaccines are safe, they're effective. I just got my booster as a healthcare worker yesterday. I promise you I'm practicing what I preach. And that's just going to continue to be so important as we use this 21st century tool to
Mhm.
try to limit this epidemic that we haven't seen on this scale for 100 years, right?
Yeah,
So the
100 years.
response has to be that great in return. Um, uh, and I think that we're going to see in terms of things that we might not see change for a while. I think there are some folks that have become very, very phobic of
Mhm.
germs. I think we're going to see some folks be very, very careful about going out and having a hard time relaxing, even when it does become safe. I do worry about that.
Yeah, yeah, I can see that because I see that now. A lot of people are very suspicious, and the sad part about this vaccine, never I can't remember in my lifetime ever knowing that a vaccine was so politicized. I mean, I think that really hurt us as a country as well. The politicization of the vaccination, but the vaccines, because we've been living with vaccines. People don't think twice about getting a bunch of shots if they want to take a safari to Africa, or
Mhm.
we just don't think about it. And this particular vaccine, unfortunately, has become politicized. So, hopefully that stigma will be removed
Mhm.
from that. But
Agreed.
celebrate your health, ladies, and take care of yourself. Is a term, that's the title. And uh, again, as we started with that. And so as we start to wrap up here, your best advice, doctor, in terms of how we celebrate our health as ladies and take care of ourselves.
One of my other favorite metaphors I haven't sprung on you yet is I'll say to folks, if you think you have a lot on your plate, okay, just remember you are the plate. Don't drop yourself.
I love that. There's another one. I can't remember. You are the plate. Okay. Uh,
Um, and truly, we're here in our messy human experience to be able to find connection and joy and give compassion and receive compassion. And that's really meant to be part of this messy human experience as well. We're going to have ups and downs. We're going to have times when different parts of our bodies breaks down. We're going to have times when we're really caring for a loved one, when the same thing is happening to them. But to remember that we can hold ourselves up in joy, and we can hold each other up in sisterhood, and um, we can really support each other as people, and never ever underestimate the power of a group of determined women.
I love that. I love it, love it, love it. We have resources for you before we have to say goodbye. Community mental health, 1-800-662-HELP. Is that correct?
That is correct.
Okay. Aunt Bertha, Indiana. Aunt Bertha, just Google, as you say, Google is your friend. AuntBertha.com, I think, or at least Google Aunt Bertha
Mhm.
for intervention. And of course, the Saundra Eskenazi Mental Health Centers, and that can be found at what, eskenazihealth.edu?
That's
Or
correct.
Saundra, yeah, okay, Eskenazi Health. Dr. Heather Fretwell, thank you so, so very much. I have so enjoyed talking with you. We could talk for a lot longer, but I think I'm gonna have to wrap it up here. But thank you so much for your time and your expertise, and you do be well as well. Take care of yourself.
Thank you so much. What a pleasure
Right.
to meet you today.
Pleasure is ours. Take care.